Thank you very much, Alistair. It's a great pleasure to be here talking about recovering cancer services tonight. So yes, my focus is going to be very much on early diagnosis. We've known for many years that early diagnosis is key to improving cancer survival. And we've worked very hard along with the NHS for the last decade or more, and with other partners as well, to raise awareness of this issue, both amongst clinicians, but also amongst, importantly, the public. When we think about the routes by which people are diagnosed with cancer, the routes that are most likely to lead to an early stage diagnosis are screening routes. At the moment, our cancer screening programs only cover about 5% of all cancer diagnoses. But over the 11 weeks to date since lockdown, around 2.3 million people will not have received a screening invitation who might otherwise have received one, because screening has effectively been paused across most areas of the UK since lockdown. It is starting to come back now, and we really need to urge people who are starting to get their screening invitations to come back into the service. The other way in which people present is symptomatically, and there's a number of ways in which this can happen. Quite frequently, and probably about a third of all cancer cases are diagnosed through an urgent or 2-week wait referral, depending on where in the country you sit. And over this 11-week period of lockdown to date, about 313,000 people will not have been or have not been referred on a 2-week wait, and that's based on a couple of weeks with the referral rates at the lowest, so that was down to 25%, around 25% of normal levels, building up to 50–60% now, and that will represent over that time just under 22,000 cancers that are being stacked up and as yet undiagnosed due to the impact on diagnostic services. Then we have routine referrals. This accounts for about 1/4 of all cancer diagnoses. Now, routine referrals may be early stage, perhaps not quite as early stage as urgents, but they also account for, over this time period, about 19,000 other cancers. And these are the ones that have not been referred in this time. So as you can see, the picture that's being built up over the 11 weeks of lockdown so far is quite a backlog of cancers that need diagnosing and treating, and that is what we are here to support cancer patients with, and the NHS, of course. CRUK has always been there to represent cancer patients. We've been listening to them over this time. The word that they use most frequently to describe their feelings at the moment is anxious. They're anxious about missed diagnoses. They're anxious about delayed treatments, of course. And the older patients in particular are anxious about catching COVID and coming in, which is why obviously the Creating Safe Cancer Hubs is so important for cancer patients. Obviously, Cancer Research UK, being a research organisation, is fundamentally funding a lot of the research that underpins much of cancer progress. And over this time, it's really important that we use the innovation and the fruits of research to apply to the early diagnosis problem. We have produced a video to encourage people to come forward. We are working with primary care to figure out how we can support clinician-patient conversations, especially when they're happening increasingly down the telephone or on a video link and not face-to-face. So there are so many things that we can do to support early diagnosis getting back on track, and this will depend on the public and on supporting the health service as well.
And those innovations can be banked going forward. They're not just make-piece things, they have worked and they're good for the future.
They've worked, they're good for the future. Triage tests, for example. And the one thing that I should say we must not forget in all of this is that when crises happen in the health service, it tends to impact on the worse off more. So inequalities tend to widen. We really have to do everything within our power to ensure that those on lower incomes, those with less education, those living in poverty are not, they are not more impacted by the COVID crisis than others.